Hi, I'm student Dr. Yagnik.
Hi, I'm Connor.
Nice to meet you.
Nice to meet you.
So what brings you in today?
I'm just having some pain in my left heel.
Okay, can you point to exactly where with one finger?
Yeah, I would say like right here.
Okay, and do you know what exactly happened, or
I'm not really sure.
are you on your feet a lot, or do you play sports or anything?
Yeah, I'm a basketball player.
Okay, so that could possibly be why. Do you know when this started happening?
Maybe about a month and a half, 2 months ago.
Okay, and is there a certain time of the day when it hurts the most?
I would say like right in the morning and then when I'm playing basketball or running or something.
Okay, and how long does the pain usually last for?
15, 20 minutes.
And what kind of pain is it? Like sharp?
Yeah, it's like I'm stepping on something like a nail or
Okay.
something sharp.
And is it mostly in that area, or do you feel it radiating or traveling anywhere?
Like across the bottom of my foot.
Okay, and do you do anything to help it feel better?
Just some ibuprofen and some ice.
And how helpful is that?
It's pretty helpful most times.
And anything that makes it worse besides the basketball?
Anything active, really, just being on my feet.
Okay, and on a scale of 1 to 10, 1 being minimal pain, 10 being a lot of pain, how would you rate it?
I'd say about a 5.
About a 5, okay. So I'm just going to run through a couple questions and then we'll move on to the physical exam. Have you had any recent hospitalizations, illness or surgeries, any blood transfusions?
None.
None? Okay. And are you up to date on your immunizations?
I am.
Did you get your flu shot?
I did.
Are you taking any medication besides the one for your foot?
Just some Claritin for allergies.
Okay. Are you allergic to anything?
No.
And any previous illnesses as a child?
Yeah, chickenpox.
What about as an adult?
Nothing.
Okay. And do you know what time it is right now?
About 4.
And the date?
The 25th of April.
Okay. Are you married?
I am.
Is it monogamous?
It is.
Okay, good. Do you smoke, drink, or take any illicit drugs?
I drink.
You drink? Okay, how many glasses would you say?
If any, maybe 1 or 2.
1 or 2 a night?
Yeah, a night, I would say.
What about work? Are you working or are you a student?
I'm a student.
Okay, medical student or?
Medical student.
Okay, thought so. How's your sleep schedule?
I sleep when I can.
I get that. How many hours a night?
Maybe 4 to 6.
Okay, that's not too bad. And you mentioned you play basketball, so I'm sure your exercise is great. How's your diet?
I try and eat healthy to match the exercise, like stay away from the fatty foods, all that.
That's good. And do you have any pets?
I have a dog.
And have you traveled outside of the country recently?
No.
No. And your family history, this just pertains to mom, dad, brother, sister, grandma, grandpa, any major history of like cancer, diabetes?
My mom's mom had diabetes and my dad's dad had a heart attack.
Okay. So that's all for the questions. I'm going to move on to the physical exam if you don't mind scooching on the table for me.
Oh, sure.
I'm just going to start off with the vascular exam, making sure that you have good blood flow everywhere. So I'm going to start off with taking 3 pulses. There are 3 major pulses in the lower extremities, the dorsalis pedis, the posterior tibial, and the popliteal. So I'm just going to check those. If you don't mind lifting, you might feel a little pinch right here. Good. Good. And now I'm just going to check the temperature, making sure that it's consistent all throughout. And I see that you have normal hair growth, so that's also great. I'm going to check your capillary refill time. So I'm just making sure that all the blood is going down all the way throughout your feet. And your skin is going back from that white color back to your pink, which it is, so that's great. And you're just going to feel a little pinch. I'm just checking for turgor elasticity, and that's great. The next thing I'm going to do is your derm test. I'm just going to check your nails for any signs of fungi, and I don't see anything. And then I'm going to check in between your toes for this stuff called macerations. It's this gooey stuff, and you don't have that, so that's great. And I'm going to check for any bumps, open wounds, lesions. Looks clear, and this looks great as well. Surprised you don't have any bruises for being a basketball player.
Oh yeah, I've been taking a little time off, so I've had time to heal.
Yeah, that's good. When did you stop playing?
About a week ago.
A week ago. So you were playing when it was still hurting you.
I was trying to play through the pain.
That's not good. Okay, so the next thing I'm going to do is the musculoskeletal exam. basically I'm just gonna check the muscle strength of all your, both your feet. So if you don't mind just pushing across, pushing outwards, pushing inwards, pull in, okay, good. If you feel any pain at all, just let me know, because I know this foot is bothering you. I'm gonna check your range of motion, making sure that all your ligaments are nice and strong. Okay. And the last thing I'm gonna do is this test called the silver square test. I'm just making sure that there's no tightness or anything. So I'm just gonna put your foot, okay, and then lift. Thank you. Good. Is it okay if I do it on this one?
Yeah, it might just hurt a little.
Okay, let me know when it hurts.
Ooh,
Okay.
there it is.
Just lightly. This hurts you as well?
Oh, yeah.
Okay. Okay, so we'll take care of that. The last thing I'm gonna do is the neuro exam, and I'm just gonna start off with this Sims-Weinstein monofilament exam, and I'm just gonna poke you in 10 different spots. It's not gonna hurt. Just let me know when you feel it. You're gonna have your eyes shut. Okay.
Yes. 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 Yes.
Okay. And then over here.
Yes. 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 Yes.
Okay, good. The next thing I'm gonna do is the sharp and dull test. Same thing with your eyes closed. You're just gonna let me know if you feel something sharp or if you feel something dull.
Dull. Sharp. Dull. Sharp. Dull.
Good. Okay. The next thing I'm gonna do is the proprioception test. I'm just gonna hold one of your toes, and you're gonna tell me if I'm pushing up or pushing down.
Up.
And which toe it is.
Second toe.
Good.
Down. Big toe. Up. Second toe.
Okay, great. Okay, the next thing I'm gonna do is I'm just gonna tap several landmarks with this thing, and it's just gonna be a little buzz, and you're gonna let me know when you feel it.
All right. Yes. 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 Yes.
Good. Okay, and then the last thing I'm gonna do is check your reflexes. Sorry, if you don't mind coming down on the table for me to think about it for a second. I'm just gonna hit you. Good. Good. Okay, and then this one. Okay, and then, sorry, we're gonna have to lift this. I'm just gonna do one more.
Do you want me to slide back?
Yes, please.
So you don't have to hold my legs out for long.
I know, you're really tall for a basketball player. It makes sense. Okay, that's good. So your reflexes look great. I'm just gonna check the area of concern now. You're gonna have to scoot back even more. You're so tall. Okay. So it seems to me like you have plantar fasciitis, which is a very common condition in athletes and runners, and it's basically just inflammation of a band of tissue that runs from your heel to your toes. And what we can start you off with is conservative treatment, and I'd recommend like doing some stretches. We can give you a packet of a couple of stretches you can do on your own time, but I would hope you do them.
Mm-hmm.
And we'll also give you some ibuprofen. I can prescribe you a little stronger dose to help with the inflammation and to help reduce the pain. And if that doesn't help, we can look at orthotics and some steroid injections. But for now, I think that should really help you. Also, if you roll your foot on a ball, that will really help. But we'll have you back in 2 weeks, and we can see where you are and go from there. But for now, we'll keep that going. But do you have any other questions?
I think that's it.
Okay. Well, it was really nice to meet you.